Hello, can I come in?
Come in.
Hi, good morning. My name is Kelly. I'll be your student nurse today. How are you?
Good, how are you doing?
Good. Can you please confirm your first and last name and your birthday for me?
Ellie McDonald, 0206, 2003.
All right, thank you. And do you have a preferred name, Ellie?
Ellie's fine.
Okay. And do you have any allergies?
Mm-mm.
All right, thanks for letting me know. So today, Ellie, I'll be performing a head, ears, eyes, nose, and throat examination. Is that okay with you? It should take no longer than 10 minutes.
Yeah, that's fine.
All right, so what brings you in today, Ellie?
So I fell off of my razor scooter, and I hit my head, so my neck's kind of hurting, and I have a little bit of a throb in the back of my head.
Okay, sounds like a nasty spill.
Yeah, a little bit.
Yeah, and you said you have some head pain. You said in the back of your neck.
Yeah, so it's kind of the back of my head, but then like kind of my left neck is sore too.
Okay.
Yeah.
And did you have any other injuries besides the head and kind of neck pain when you fell?
Just a few little scrapes, but nothing major.
Nothing major. Okay. And do you have any other symptoms with a head injury, like any dizziness that you felt, or?
No, I wouldn't say so. It was just kind of the first initial pain of kind of hitting the ground, but besides that, there hasn't been anything that's like too concerning. But I figured I'd just come get it checked out.
Sure. Okay, I understand. Yeah, definitely got to get checked out. And do you have any history of head or any neck injuries previous to this fall?
Nope.
Okay. And have you had any difficulty with your vision? Any sort of like blurriness or any sort of drainage or anything that you've noticed?
I don't think anything out of the ordinary.
Okay. And do you wear contacts or glasses?
No.
Okay. And have you had any ear infections recently, or any hearing loss, any discharge, like liquid from your ears?
Mm-mm.
No? Okay.
No.
And have you recently had a cold or any sort of sinus pain, like any sort of nasal congestion?
No, I wouldn't say so. I'm generally a healthy individual.
Okay. And have you had an issue with anything with your throat, like a sore throat, or any sort of issues with your taste buds, or like things are tasting weird or altered sense of taste?
I wouldn't say so.
No? Okay. And do you consume alcohol or do you smoke?
No.
And have you had any issues with your mouth, like with your teeth or any sort of difficulty swallowing?
I don't think so.
All right. Thanks for letting me know. And so at first I'm going to start off by inspecting your head, if that's okay.
Sure.
I'm going to palpate the head for the position, any sort of lesions, symmetry, the scalp. And you said that bump was on the left side of your head back there?
Yeah, just back there.
Okay. Yeah, I do feel.
Yeah.
Lump here. And have you done anything to help with the pain with the lump? Any sort of like ice packs or anything like that?
Yeah, I iced it whenever I got home and kind of later that night, but nothing since then.
Okay. And I'm just going to palpate your face, okay?
Okay.
And did you have any injuries that you noticed, like face? Like, did you fall on your face? I know you hit your head and your neck, but...
No, I kind of fell backwards.
Okay.
It was kind of an awkward fall, but...
All right, thank you. So, your skin and your scalp, I don't notice any abnormalities there. And everything is symmetrical with your head and as well as your facial features. I did notice that lump on the left lower part of your head. All right. And now I'm going to check your vision, okay? So I'm going to give you a chart. And if you could please cover the one eye and tell me the lowest line you can read, and then cover your other eye and tell me the lowest line you can read, okay?
Okay. Okay. 3, 7, 4, 2, 5, 8. That's my left eye.
Okay.
My right eye. 4, 2, 8, 3, 6, 5.
All right.
That's my right eye.
So I'll document that. Looks like you can see line J2 with your left and J3 with your right.
Yeah.
And now I'm going to inspect your eyes, okay?
Okay.
see the conjunctiva. And you not notice any sort of issues with your vision you mentioned? No?
Nothing.
Any sort of drainage or abnormalities, bleeding?
Nope.
Okay. So I've assessed the conjunctiva for the color, drainage, and lesions, and the sclera for the color and the surface characteristics there. And the iris and cornea all are intact and symmetrical. Now I'm going to test your vision, how it reacts to light, okay?
Okay.
So I'm going to bring the light into either side. And if you just look straight ahead at me. All right, thank you. And now I'm going to test your peripheral vision. So if you could just please tell me when you see the object.
I see it.
Okay.
I see it.
Thank you. And now I'm just going to check your vision one more time. So if you could please follow the item and not move your head, but just move your eyes only, okay? All right, thank you. So your pupils are equal, reactive, and responsive to light. I don't see any issues with your vision there. Now I'm going to inspect your ears, all right?
Okay.
Have you noticed any sort of bleeding from your ears or any sort of drainage?
No, I wouldn't say anything.
Okay, thank you. And have you had any hearing loss or any sort of muffled like sounds or any sort of issues in either one ear? No?
Nope.
All right. Just gonna inspect your nose, okay? Don't see any abnormalities here. Everything seems to look symmetrical. Okay. All right, I'm just gonna inspect your mouth, okay?
Okay.
Maybe open your mouth for me. And can you lift up the back of your tongue? All right. And then can you say ah? All right. Check the teeth and the gums, the lips here. Okay. So check the teeth and the gums for the color, condition, alignment, the tongue for movement, symmetry, color, the uvula, the tonsils, the posterior pharynx. And now I'm going to inspect your neck, okay?
Okay.
And you said you were having some neck pain when you fell, and that was on the lower left side you mentioned?
Yeah, it kind of like, I wouldn't say radiates up, but just kind of like is the whole muscle on the left side of the neck.
And you say, how would you describe the pain in one word?
Dull.
Dull. Okay. And could you please turn your head this way for me? And do you feel any pain?
Yeah, whenever it kind of like stretches out like that, yeah.
Okay. And turn your head the other way, please. Do you feel any pain there?
I wouldn't say so.
No pain there. And then can you hold your head back for me? Any pain there?
There's a little bit of just kind of like cramping, but nothing like too severe.
Okay. And then could you point your head down?
A little bit again whenever it kind of strains it.
Okay. And then can you do a circle for me with your head? And did you feel
That's correct.
Okay. Did you feel pain there?
Yeah, a little bit.
Mostly on that left side?
Yeah, it doesn't like leave anywhere really. It's just kind of whenever it kind of pulls at that specific side.
Okay. Understand. Bring that down. And I didn't notice any lumps or masses on your neck. All right, that's the completion of my assessment. Is there anything else that you'd like to mention for me?
I don't think so, no.
Okay, I've documented about the lump in the back of your head, the lump in the back of the neck, and I will come back with some further information. All right, thanks for letting me assess you.
Okay, thank you, Kelly.
You're welcome. Bye-bye.
Bye.